This is Sirenum.
Even during normal regular operations, healthcare organizations are constantly challenged with putting the right person in the right place at the right time. During a crisis like the COVID-19 pandemic, that challenge is even harder and more critical. That's why Sirenum is excited to help the healthcare community with its workforce management solution for hospital staff management. Today we're going to see how easy it is to match your teams to shifts so that you can reduce fatigue-related infections with real-time visibility of staff fatigue, minimize staff shortfalls with live capacity management and the ability to find replacements within seconds, improve staff engagement with the Sirenum mobile app, and facilitate business-as-usual operations with a single platform that allows for segregation between COVID and non-COVID wards. We start today by looking at a dashboard showing important operational information. From there, we'll go into the scheduler, which helps administration build and manage rosters. In the scheduler, you'll see a series of cells, each of which represents a shift. In that cell, you'll see basic work information, like the site, job role, and times of the shift. There are also a series of icons that speak to the health of the shift. If there are problems with the worker's fit to the shift, for example, you'll see an error message. I want to highlight in particular the numbers found in the circles and rectangles. These are the fatigue and risk indices. They measure the impact of challenging shift patterns on the risk of keeping those employees on the shift. As you can see, Antonio Whitaker is facing a tough series of shifts over the weekend, and his fatigue and risk index have both shot up to very high levels. Sirenum's advanced matching engine, which considered more than 30 factors, enables me to easily find a replacement for Antonio on that shift. Someone who doesn't have a fatigue concern and also meets all the demands for the shift, credentials, availability, and more. Sirenum also makes it easy to find a resource for an uncovered shift or a shift requirement with its open shift distribution tool. Here we have a shift for an overnight attending doctor for next Tuesday. With one click, I can open up this shift and send it to all the relevant and available doctors on my roster, including the person I've logged into my Sirenum as, Aaron Michaels. As you can see, I've been notified on my mobile app about the available shift and given the chance to accept or decline. Once I accept it, I can go back to the scheduler and see that the shift has been allocated to Aaron Michaels. Sirenum for Hospital Staff Management makes it easy for hospitals and care homes to manage their entire workforce across multiple disciplines. To learn more, visit sirenum.com/hospitals.